let's go ahead and get started. And whoever joins us, they can join us, but I don't want to take away from the time that you guys have graciously given us for this evening. So welcome everybody. Like we said, it's Friday Eve. We've almost made it to the weekend. So I just want to take a minute to introduce myself and the team behind putting these webinars on. So they've been doing a lot of work throughout the week to get this information out to you guys. So I definitely want to give them recognition. So my name is Heather. I'm the program manager for the Child Care Health Consultant Network. But I really can't give myself credit. I got to give my team the credit. But team, when I say your name, just feel free to wave hi. You don't have to come off a mute or anything. But Miss Rachel, she has been our tech person, keeping us running straight, keeping us from those hiccups. Miss Tanisha, she keeps us organized. Like she's, going to keep us on time here. But she's been a tremendous help as well. Miss Brittany, and I'll introduce you to our nurses a little bit later on, but Miss Brittany is one of our nurses. Same with Miss Erica, who presented last week. If you were on, she is one of our nurse consultants as well. I have to give a shout out to Sarah as well. She keeps all of us going and all of us sane. So I have to definitely give a shout out to Miss Sarah. And then last but not least, Miss Jessica. And Miss Jessica is also here to support our Spanish speaking providers as well this evening. So Jessica, I don't know if you wanted to come off a mute and just say hi to them as well.
Sure, thank you, Heather. Hi, everyone. Buenas tardes, mi nombre es Jessica. Si necesitan que le traduzca algo, tienen alguna pregunta, por favor en el chat pueden poner sus preguntas, nada más seleccionando mi nombre, o pueden decir nada más mi nombre y yo les traduzco lo que tengan que decir. Gracias. Thank you, Heather.
Thank you, Jessica. All right, Miss Rachel, go ahead and start sharing your slides if you don't mind. So tonight's topic is really, we're diving into COVID. Last week, we talked about how do we modify our day-to-day practices in early childcare and what we can do. But tonight, we're really going to talk about COVID. We're going to talk about some myths that are out there, get some resources in your hands, and just help you better understand all of the jargon that we hear around COVID. But you don't have to listen to me talk tonight. Our nurses have very graciously offered to share this information with you guys. So tonight, Miss Erica and Miss Brittany will be presenting. I'll give you a little bit of their background so you just kind of know what their qualifications are and everything. So Miss Erica is a registered RN. She has a master's degree in public health, with a total of 5 years in nursing. The past 2 years, she has served the Child and Youth Services on a military installation, and they served children from 6 weeks up to 18 years old, so right up until they become adults. And she did a lot of training and coaching with medication administration, bloodborne pathogens, communicable diseases, just to name a few. And she is also qualified to teach first aid and CPR. And the newest, both of our nurses are new to our team, but the newest nurse on our team is Miss Brittany. She's a registered nurse as well. She has a bachelor's of science in nursing. She's been a nurse for the past 6 years. The past 4 years before coming to us, she worked at the Department of Corrections. So she has seen firsthand how crucial it is for kids to get off on the right foot. So she's super excited to be making this transition into her life, going from working with adults to working with children and childcare providers, because she knows how important it is that they get off on the right foot. So ladies, I turn it over to you to take it away. Actually, I apologize. I forgot to give a shout out to our funders as well, KDHE, and in partnership with the Children's Cabinet, the ones that make all of this work possible. And then the last thing I will just add is any questions that you might have, feel free to put them in the chat as our nurses are presenting. We will come back to them at the end, but we want to get through the full presentation before we start answering questions. Okay, now I'm all done. So Miss Erica, Miss Brittany, take it away, please.
Okay, I guess I will start. Tonight we're talking about COVID-19, which is a coronavirus. The coronaviruses are a large family of viruses. Some are cold-like illnesses that usually cause mild to moderate respiratory tract illnesses, kind of like the common cold. The COVID-19 virus is the SARS-CoV-2, and it was discovered in 2019. It is mainly spread person to person through respiratory droplets, such as our little guy there. When you cough, sneeze, talk, you let off little droplets that can carry the virus. These can be suspended in the air and can travel distances further than 6 feet, although the recommendation is about 6 feet. There are people who can be infectious before they're symptomatic, and you can be infectious even without having any symptoms. And the symptoms to that illness can, when they do appear, if they do appear, can range in severity to very mild or to more severe. And we have this little video here that kind of goes over the different variants, or what the different variants are.
Con manteca le dan las vamos a fritar así, con manteca.
Okay, so next we kind of wanted to talk about some of the myths that surround the COVID-19 virus. There's a bunch of them. First, we have that if you've had COVID-19 before, you're immune to getting it again. There it is. The immune response from an illness is less predictable than Unfortunately, if you've had the virus before, you can get it again. I will say that the immune response from getting the illness is less predictable than the immune response after the vaccine. Those who haven't gotten the vaccine after recovery or even before recovery are more likely to end up with the virus again. Another one is that the vaccine will prevent you from getting COVID. It can't prevent you from getting the virus, although it can lower your risk of getting and spreading it. It can't completely prevent it. The vaccine does help prevent against serious illness and some of the worser or some of the more severe impacts of the disease. Coronavirus is the same thing as COVID-19. Coronavirus is a large family of viruses. There's hundreds upon hundreds of different variations of the coronavirus that cause respiratory illnesses in humans, some like the common cold. Some of the coronaviruses actually like to circulate among animals like bats, pigs, camels, or cats. The COVID-19 vaccine makes people who receive the vaccine contagious. The vaccine is not a live virus. They will not cause you to shed any of the vaccine components outside of the body. Oh, I skipped ahead. Sorry. The COVID vaccine can cause the variants. As the virus spreads, as we saw in the video before, it mutates and grows like a tree. It changes how it looks, how it adapts to what we do to prevent it or recover from it. Some general practices for staying safe and healthy during COVID-19 pandemic as we continue through this. Continue to wash your hands for 20 seconds at a time with warm water and soap. Sing the ABCs or some type of little song in your head, or if you're like me, just count to 20 twice because I count fast. Wear a well-fitting mask. That means your nose and your mouth are both covered. There's no gapping at the sides. This is recommended for those 2 and older. Stay physically distanced but socially connected. Just maintaining your 6 feet. Increase fresh air. Play outside. When you're inside, have the windows open, as this can help circulate and push kind of the stale or the air with the droplets hanging in it outside. Clean and disinfect. Always important. Make sure that you're following the manufacturer's guidelines when cleaning. Stay home when sick. I know that one's hard. But staying home when sick is the best way to prevent the spread. It's also the best way to prevent yourself from getting the virus if you already have a weakened immune system and that's not necessarily what you're sick with. And get vaccinated. It does help with the symptoms. It can't prevent you from getting the virus, but it can help lessen the severity of your symptoms.
All right, and this slide here may look familiar to you if you joined us for COVID series session 2. We are duplicating it here because it's really applicable to both topics, but it's that handout that we've hyperlinked that you could, if you receive the slide deck, you can print this out yourself and you can post it in your facility if you want a visual aid for parents. It addresses children's symptoms of COVID. It comes from the American Academy of Pediatrics. And it says, did anyone in your household or your child have these symptoms in the last 24 hours? So this is something that we wanted to make available to you if you need a reminder for your programs. Next slide, please. This is a pretty general statement. We're going to dive a little bit deeper into things with COVID as the slide deck goes along. But in general, children shouldn't enter your program if they've had close contact with someone who's COVID-19 positive, they're waiting on results from a COVID test, or they've recently been diagnosed with COVID-19 and not yet continued or cleared to discontinue isolation. Next slide, please. All right. We talk a whole lot about reasons children shouldn't come to your child care program. And so we did just want to address that there are still some symptoms or conditions children could be experiencing where they can still come to your program. So this comes from Caring for Our Children, and we have hyperlinked this information into the PowerPoint. So if you receive the slide deck, you can go in and you can read this in more detail. The common cold typically is not associated with a fever. So if that child comes to your program, they're well enough to participate and they're not a risk to others, they could potentially come in and participate. I appreciate this next bullet a lot because Caring for Our Children went in and further defined how we're looking at a cough. This is a cough not associated with fever, difficulty breathing, wheezing, or blueness of the skin. Some children, maybe they have a history of asthma, so they have a little bit of a chronic cough, or maybe the cold, dry air precipitates a cough in them, that kind of a thing. So we do want to make sure that we're looking into cough and kind of the other symptoms that are associated with it when we exclude for that. Yellow or white eye drainage not associated with pink or red whites of the eyes. Some of your infants maybe have like a blocked tear duct where they do produce excess eye drainage. Those infants, they're not contagious to others. So if you know that's a condition they have, then they would be okay to come to care as well. Thrush is essentially a yeast infection in the mouth or throat. These kiddos may be under treatment, but again, if they can eat and drink and participate comfortably in your program, they are not communicable. They're not contagious to those others around them. Middle ear infection, this could be associated with an excludable illness. So sometimes we see middle ear infection with a virus or a bacterial infection. In that instance, we'd have to look at it a little differently, but middle ear infection by itself is not contagious to others. And then I do encourage you, if you'd like to read about it more in depth, to click on that link and we can go ahead and move on. All right, so we talk about screening those kiddos. We have to screen our staff as well. So staff experiencing these symptoms should not enter your program. They've got a fever. One of those numbers that's kind of been seared into our brains with COVID-19 is that threshold of 100.4 degrees or higher. Okay, if they're experiencing that, chills, sweating, new cough, fatigue, new loss of taste or smell, hallmark symptom, sore throat, headache, runny stuffy nose, muscle pain or body aches, nausea, vomiting, or diarrhea. Also, if they are waiting on results for a COVID-19 test or they are positive for COVID and haven't been released from isolation, they shouldn't be entering your program. Some of these symptoms, like fatigue, for example, if Jenny comes to work and Jenny is exhausted, but Jenny didn't sleep last night, that's not the reason that Jenny doesn't need to be at work, okay? So we have to look at these symptoms kind of in combination with the real life situation and go from there. But as general guidance, that's the criteria for your daily staff check. And we can go ahead and move on. All right, so how long to isolate and quarantine in daycares? When we talked about this in session 2, the document from KDHE had been updated on the 11th of January. They went in, they updated it on the 24th of January, and I really didn't see that they made any revisions to the section about daycare. So the guidance we have is that the CDC is currently working on new recommendations. Until we get further guidance, KDHE recommends a 10-day quarantine for patrons and staff who are susceptible close contacts to a positive COVID-19 case. The operative word there is susceptible. So I'm going to dive a little deeper into that definition in slides to come. Okay, so we'll hold on to that. Decisions to shorten quarantine periods for staff in the event of critical staffing shortage should be made through consultation with your local health department. KDHE does recommend that patrons and staff with confirmed or probable cases of COVID-19 isolate themselves for the full 10-day infectious period. And if you would like to look over this document for yourself, we've included the link there at the bottom. All right, so this is where I want to mix it up on you a little bit, Miss Rachel, I'm sorry. But this, okay, so if you feel confused about when people should quarantine or isolate, this is why. So they've tried to spell it out, but there are so many caveats to this. So if you don't mind, Miss Rachel, clicking on that link for me, we have hyperlinked this for you, so you have access to it yourself at home. But when you open this bad boy up, there's like circumstance upon circumstance, okay? So when I use the term isolation and quarantine, people use them interchangeably. They're not the same thing, okay? So if you've tested positive for COVID, you have to isolate. If you've been in close contact with somebody else who's positive for COVID, you gotta quarantine, okay? So we're starting out here, we're talking about, and because I'm trying to, oh, yep, thank you, Miss Rachel. Talk about isolation. You can see here where it says for mild to moderate cases. So these are the people that have had COVID, they have to isolate, but they're doing pretty good, okay? If that's you, it says to isolate at home for a minimum of 5 days after onset of symptoms, okay? And if you're able to wear a well-fitting mask on day 6, you can be released from isolation and return to regular activities. This is only if you have been fever-free for 24 hours and your other symptoms have improved, whichever is longer. So caveat upon caveat here. And then in addition to that, I just told you in the previous slide, KDHE's recommendation for the daycare setting is for any worker in a daycare or any child that comes to program, they should isolate for the full 10 days, okay? If they're COVID positive, they really should isolate for the full 10 days. So you may hear some of your parents or in the general public talk about this rule for isolation, but according to the KDHE guidance, still isolating for the 10 days. Now, Ms. Rachel, if you don't mind scrolling down to where it talks about quarantine, this document goes on and on. It's going to tell you about severe cases, so you can look through that if you choose, but their isolation period's different. Then when we go to quarantine, it says who needs to quarantine. Close contacts if they meet any of the following. People who have gotten 2 doses of the COVID vaccine over 5 months ago that didn't get a booster shot when they were eligible. You're no longer considered immune. You would need to quarantine. People who received the single dose Johnson & Johnson over 2 months ago and didn't get a booster shot when eligible, you need to quarantine. And then those who are not vaccinated or have not completed a primary vaccine series and do not have evidence of recent infection in the last 90 days. And then because we're short on time, I'm just going to tell you, if you scroll down, it'll talk about household contacts, because I know you guys got some of that going on too, where you've got somebody in the house who's positive. So if you keep going, Miss Rachel, it'll show you examples of what constitutes a household contact. If they can separate from each other, they might be able to isolate and quarantine at the same time. So if you like to read things and have visual element to help you work through it, this is available to you and it's linked in the PowerPoint presentation. Okay, and then we can go ahead and go to next slide. Thank you for entertaining me and opening that up. All right, so if you have somebody come to your program and they need to find a testing site, this tool has been made available by KDHE. It's a map of the state of Kansas and you can look by zip code for a testing site in your area. If you would like to participate in a testing program that KDHE has partnered with, there's a company called Battelle, and they manage COVID-19 testing for 16 Midwestern states. It is a program that's offered at no cost to the provider or facility that wants to participate. If you do want to participate in testing at your program using Battelle, best practice is to develop a testing policy for your staff and children. Services are available through Battelle to assist you with implementing the testing process, registering those kiddos and staff for testing, and receiving results. So if you want to connect with them, you can contact them directly. We provided the number for you. They do provide 2 different types of testing. So it's only ages 3 and up, but saliva testing is available for those kiddos 3 years of age and older. And then nasal swab testing available to children as young as 5. After you collect your sample, your results should be available in 24 to 48 hours. From there, those samples can either be picked up by a courier or you can ship them. And then those results are provided to the sample site test reader, the participant or guardian, Health and Human Services Protect, and the appropriate public health authorities. I will tell you, if you want to participate in this, we're not saying you have to, should, it's nothing like that. But if it's something that you want to do, one way that you could use this program is like to test your staff and your kiddos on a Friday, because it takes about 24 to 48 hours to get those test results back. And then in theory, you'd have them over the weekend so you could contact any positive cases and let them know not to come to program on that Monday. All right, guidance for vaccinated people. We kind of went over this with our KDHE chart, but if you've been fully vaccinated and you're eligible for a booster but haven't received it, you're no longer considered immune and you should quarantine after exposure to a positive COVID-19 case. If you've received a booster, you're not required to quarantine if you've been asymptomatic. You need to wear a well-fitting mask that covers both mouth and nose for 10 days since exposure day when you're around other people. And then the recommendation is to get tested at least 5 days after last having that close contact with somebody with COVID-19. If those results are to come back positive, immediately isolate and follow the CDC recommendations for isolation. The recommendation for COVID-19 vaccination for children from the CDC. So most of you probably know emergency authorization use has been put in place for the Pfizer vaccine for children ages 5 to 11. The Pfizer vaccine is also available for 12 to 17-year-olds. And then if somebody's 18 years old or older, you'll see they could get Pfizer, Moderna, or the J&J vaccine. It is recommended that anybody who gets the Johnson & Johnson vaccine get a booster with Pfizer or Moderna 2 months after they get that J&J vaccine. And then it does also list that anybody 12 years and older should get a booster at this point. So why vaccinate children? The CDC says that COVID-19 actually ranks as one of the top 10 causes of death for children ages 5 to 11 years old. By being vaccinated, those who can get vaccinated, they actually protect the people around them that can't. So if there's somebody in your household that's younger than 5 years of age, you've got an infant or somebody who's maybe allergic to a component of the vaccine, by getting your own vaccine, you're actually offering them protection. It can help decrease the severity of illness, as Ms. Brittany was talking about. Maybe not always prevent it altogether, but definitely lessen the symptoms. And it can also keep our kids in school and safely participating in those extracurricular activities, which are so important for development. Immunization policies. We're talking about this in general. As you all know, COVID is not part of the routine childhood immunization schedule, but we did just want to touch on this because at a time where we're facing a pandemic, we want to ensure that we're also protected from other vaccine preventable illnesses. Caring for our children does recommend that you have a written policy for getting medical information from your families. You would want to say something like in your handbook that a child health assessment's due within 2 weeks of admission, or you require an appointment slip that indicates they're going for that visit. The immunization record should be provided at the time of enrollment. And then you do want to keep those child records on file at the facility. If you need some tools to help you review immunization documentation and make sure that your children are on track, we have Appendix G from Caring for Our Children linked here, and it'll give you all those tools from the CDC to look at when the vaccines are due. We can go ahead and move on. This map shows you, because there are some instances where children will not be fully vaccinated. So if you look at Kansas, it's color-coded purple. That means in the state of Kansas, we do honor religious waivers for vaccinations as well as medical waivers. And it varies from state to state, as you can see there. Okay, this is a section of the bottom portion of the Kansas Certificate of Immunization. If you want to access this full document, you can. It's been linked for you. But the statement I'm highlighting here is the legal alternatives to vaccine requirements. It says they either have to have an annual written statement from a doctor that's been filled out, and that is the KCI Form B, and you attach it to this Kansas Certificate of Immunization form, or they have to provide a written statement signed by one parent or guardian that the child is an adherent of a religious denomination whose religious teachings are opposed to such tests or inoculations. And then in this next slide, we'll show you what that Form B looks like. If you need this document to provide to families so they can take it to their medical doctor, we've got it linked here for you. Other than those two exceptions, you should have kiddos who are on track with their routine childhood immunization schedule. This algorithm will help you if a child becomes sick or COVID-19 positive in your program. The link is below, so I'm not going to walk you through step by step here, but if you do need to isolate a child and they're having symptoms of COVID-19, this walks you through step by step what you should do. All right, so how would you disinfect after a positive COVID-19 case has been in your facility? Before you go to clean and disinfect that area, you want to close it off, that area that was used by the person who is sick, and then wait as long as possible before you go in to clean and disinfect. As Miss Brittany said, and then we illustrated with that picture, that COVID-19 is primarily transmitted through respiratory droplets. So if that person has been in there coughing, sneezing, talking, you want to give it time for those particles, those droplets to settle. So you're not walking in behind them and just inhaling them right up into your own nose or mouth, okay? So once that period of time has passed, you'll go in to clean and disinfect. When you do that, again, increasing your ventilation, like Miss Brittany said, is going to help move in the clean air and move out the pathogens or the germs that might be, kind of stagnant in that room. So using fans also to increase air circulation. Wear personal protective equipment. So when you're going to clean and disinfect, mask and gloves. Focus on those immediate areas that were occupied by the sick person. Any dirty linens that are in there need to be washed. Those can be thrown in with other laundry. Okay, it's okay. We do recommend that you wash on the highest setting and dry it on the highest setting as well. Always follow the directions on your product labels. So when you're using your disinfectants, that's really important that you read your labels. And if you need to make sure that a disinfectant is actually effective against COVID-19, the EPA has this tool that we've linked in the presentation for you called List In. And it has a tutorial of how to even use List In and all of that. So that is available for you all as well. Program measures. This is just a note to let you all know that Child Care Aware of Kansas and KDHE are not going to tell you when to close your facility. So this is the business that you own. You can work with your local health officials to determine whether or not the facility should remain open or if it should close after positive cases of COVID-19. In times of critical staffing shortages, KDHE does advise that the child care programs consult with local health department about shortening any quarantine period for staff. And that wraps it up for us today. I see we've got a question in the chat.
Yes, the question is, Ms. Erica, and this is from Nicole. It says, if a pregnant or nursing mom gets the vaccine, does that immunity, is that immunity given to the baby?
So my short answer, and I'll let Brittany chime in if she's got additional things to add to it, is the mom provides some protection to baby while she's pregnant, but once they're born, they get a little protection from breast milk if you're nursing them. However, that immunity is pretty short-lived. So no, it's not going to give them full protection from COVID-19 like it would if they'd gotten vaccinated.
Does anybody else have any questions that they would like to ask Miss Brittany or Miss Erica? Miss Jessica, do you have any questions from any of our providers as well?
None have come to me. Las que hablan español, si tienen preguntas, las pueden hacer o me pueden mandar un mensaje.
All righty. Well, that's okay. Sometimes you got to take in the information, process it. And, you know, of course, we're here if you do have any questions. On the slide, we do have the Child Care Health Consultant Network contact information, so you can shoot us an email and we can get you in contact directly with one of our nurses, or if you just want to talk with one of our child care health consultants who can help you with any health, safety, and wellness needs, we are more than happy to get in touch with you. So feel free to put your name and your license number in the chat if you would like to, you know, get something set up. But of course, you can reach out to us at any point in time. All of the resources and all of the links that Erica and Brittany had mentioned throughout the slides, we are going to be sending those out in a separate email. It will probably go out early next week. So you'll have access to all of the links, and we will also be sending out the slides as well, because there was a lot of good information in there. So stay tuned for that. Oh, let me see here. Okay, so we did have a question pop up in the chat, Miss Erica, Miss Brittany, so I'm going to tag you guys back in. So the question that came in on our chat was on the chart that you check child symptoms and she's confused about the cough section. So can you guys dive a little bit deeper into that?
Sure. So the further explanation given by Caring for Our Children, I mentioned that I like going more in depth with that because it does mention if it's a cough, but it's not associated with fever, difficulty breathing, blue skin, those types of accompanying symptoms. A child may have a minor cough for a reason that's not attributable to a contagious illness, like maybe they have a history of asthma. If you have a child and their only symptom is cough, and you still feel like, I'm just not sure, it can be a part of your facility policy that, you know, you do require a provider's clearance note for them to come back to program if you're ever worried, you know, about them being contagious. But we do like to highlight the fact that although it is included as a symptom of COVID, it could be a symptom of other things as well. So cough by itself, it's kind of hard to exclude for just that. But if you're in doubt, you certainly can ask the parents to come back with a clearance note from a medical provider. Does that help clear that confusion up? Okay. If not, that's okay. I mean, we can talk about it more.
Yep, and we can definitely, you know, if you want to, we can get you in contact and you guys can have more of a one-on-one, and, you know, we can really dive into it if you would like. But great question. Let me pause for a minute because I can tell people are thinking. So any other questions? All righty. Well, like I said, you can reach out to us at any point in time. We will definitely be more than happy to make that connection. So I also did just want to highlight our part 4 that is coming next week on next Thursday. So I believe that is February 3rd, if I have my dates correct. And it's going to be in the evening as well. We got a lot of feedback that it was a good time, just because, you know, businesses are closed and you can fully give your attention and everything. So, and we're excited to share that a KDHE representative will be joining us next week. And the questions that everyone submitted when they signed up for this series have been submitted to them now. So they are going to come and be able to answer those questions. So definitely look forward to attending next week. And you know, it's a golden opportunity to be able to talk to them directly and get your questions answered. So we're super excited for our part 4. Anybody else have any last thoughts, comments, questions? Otherwise, we will give you guys the, you know, the time, the gift of time before you know, before this Friday. All righty, well, we'll hang around for a couple minutes as people hop off. If anybody wants to unmute and ask a question or put something in the chat. Otherwise, I hope everybody has a fantastic evening and a great Friday and a great weekend. Take care, everyone.